Good evening. In our news bulletin for tonight, extension at the scenic Matawai will include new rooms and a convention centre. The newly appointed director for the Niue Health Department has started work at Niue Full Hospital. Public Health Division has coordinated an activity for students to raise their level of awareness about HIV, STIs and tuberculosis. Niue bid farewell to one of its well-seasoned broadcasters, Ezra Talamahina. Construction is well on the way at Scenic Matawai Resort's 140-capacity convention centre. The construction of the new convention centre is headed by Arrow International, funded by New Zealand and the Niue government, after a culmination of years of work on the tourism infrastructure in Niue. The recent management takeover of Scenic Hotel Group New Zealand from the Matawai Resort is part of the infrastructure development that will continue to enhance Niue's tourism industry to make it more marketable.
The convention centre has had its groundwork started, and you can see behind us that the accommodation, the 12 rooms that have been provided, are well underway. It's taken an inordinate amount of effort to get to this point, but it was an arrangement between the government of Niue and New Zealand to be able to promote the shoulder season of tourism, and one of the ways forward that we felt that could happen after a great deal of in-depth study was the building of the convention centre to attract people to come here during the shoulder season. So this is the original thinking by those that were involved in the design. It's to fit the Niue environment and to take on board the landscape that we have here. So it's a completely new approach for the hotel. We were very optimistic that the convention centre will attract a new market to Niue. We could have gone ahead and just built new rooms, but we needed a point of difference. We need something new. We need something to attract people to Niue for a different reason rather than just tourism alone. And it was for that reason that it was agreed by the board and the trustees that a convention centre was the best way forward for that, to attract people to come to Niue for a convention for 3 or 4 days and experience the rest of the island.
The Scenic Matawai Resort has already hosted a few conferences and weddings, and while Niue is relatively small in comparison to other tourist destinations, the recent survey has listed Niue as the third most visited place in the world. This convention centre will add more value to that survey, with far-reaching benefits for Niue as its tourism industry continues to grow globally on the competitive tourist market.
The convention centre is quite a substantial build. We've had to shift an awful amount behind us, so we don't expect that this project will be finished until before March next year. Part of the project has been to ensure that we have a local labour content here, because all of that brings funding and economy, strengthens the economy. So at the moment here on the site we've got 16 locals involved in carpentry work and providing labour for the project. All of them are earning a salary, all of them are paying NCT on that salary, and all of that is going back into the Niuean economy. We've got numbers up from New Zealand as well. I don't know the exact numbers for that, but they will come and go as the project proceeds. So you'll bring people in for doing the roofing, doing people to come in and support the plumbing, those sorts of things.
So there will be an influx of people going in and out?
Yes, there will, but there will always be a local labour content as well, entirely necessary. And as part of that is that the local labour here is also learning new skills as a consequence of working on this site.
The governing body around the developments and owners of the Scenic Matawai Resort assets in the Niue Tourism Property Trust, which are funded both by Niue and the New Zealand government, has ownership over Matawai Niue Limited. The multi-million-dollar development is an extension from the bar area in the main building and is expected to complete by the middle of 2017. Cliven Miskilana Naipi has been appointed as the new director for the Niue Health Department. It has almost been a year since the department has been without a director, and Bob Tarling has been the acting director since August of last year. Government's employment body, the Niue Public Service Commission, says that Mr. Naipi started at his new post last week and is familiarising himself with staff and department operations. Cliven Naipi is from New Zealand and is of Niuean descent with parents from Tambotonga and Awasele. He has 15 years of primary and aged care experience with Pacifica Integrated Healthcare, and his most recent position was as the manager of Nile Road Medical Centre. Mr. Napier is now in Niue with his young family on a 2-year contract with the option for an extension of another year. Over 40 students participated in the HIV and Tuberculosis Awareness Program organised by the Public Health Division today. The program was created specifically to educate students in years 5 to year 13 about HIV and tuberculosis symptoms, how to prevent infection, and how the virus is spread.
Education is power, so if we have the information, we would need to pass it on to the younger generation. So the idea is to use the opportunity that we have, because the kids are still on school holidays, to develop a program where we would incorporate basic information on HIV, AIDS and TB for their awareness. So today the program was divided into two. We started off with presentations, giving them the basic facts on what HIV AIDS is, what are the signs and symptoms, how do they prevent themselves from getting it, and same goes for tuberculosis. Some activities where everyone will need to take part and be able to share what they have learnt from the session in the morning, and to be able to answer the questions. So thus far, we're very pleased with the turnout. We were able to identify that the kids did have learned something, and it was really quick for them to absorb the information. And our only hope is that they would be able to take the knowledge that they have gained today and share it with their friends who are not able to attend the training program, and to also share it with their family members.
Ms. Mohoia says that the young students were very quick to understand and contribute to the discussions about the topic of the day, as well as asking questions when unsure, which made for a very successful program.
HIV, AIDS, about sicknesses, what are their treatments and how to prevent them. Just having fun, teamwork, being captain.
Students were also encouraged to wear a red ribbon or the colour red that symbolises awareness, as well as supporting individuals around the world living or fighting HIV or AIDS.
With HIV and AIDS, it's not easy to see the symptoms, because 3 to 6 months is the window period where you can detect the antibodies in the blood, but by 6 to 7 years, that's when the symptoms actually show. So that so we all know that by that time it's too late for us to help the person. You're just waiting to die. But for tuberculosis, you get it from droplet infection. That means anyone who has it, when he or she coughs, the rest of the family members will be able to get it as well. We are very lucky thus far. We haven't had a HIV/AIDS case on the island, but we will continue to do our part, increasing awareness for the general public on ways to prevent themselves from getting it, because the number of flights each week has now increased, and a lot of us travel quite a bit. So we need to be able to prepare ourselves in the event that we do have a case. And I guess the message is for us not to be complacent when it comes to HIV and AIDS. And so far as tuberculosis is concerned, we have had TB cases in the past who have been treated, and up until this year we haven't had another case as yet.
The Public Health Department encourages parents, support and students to continue participating in any future health programs. Niue bid farewell to one of its well-seasoned radio broadcasters yesterday at the Alofi Ecclesia Church. Family and friends filled the church building to share and celebrate the life of Ezra Talamahina, who sadly passed away in Niue on Saturday. An eulogy presented by his son Colin described Ezra as an ambassador of Niue, always proud to represent Niue wherever he went. He contributed to developments on the island in different capacities, working for the Niue government, starting with the Administrative Department in 1969, as well as the Public Works Department in 1977. Ezra returned to the island to take up a post as the Director of Administrative Services from 1994 to 1997, and Director of Community Affairs in 1997 for 9 months. His career in New Zealand in the 1970s, he worked for the New Zealand Labour Department, eventually became a factory inspector for the Labour Department, and from 1998 to 2013, he worked for the ACC as a health and safety consultant, where he worked closely with the police force, health agencies and community groups. He also served on various boards, including the North Island Health Board, Waitakere City Council, Ranui Action Project, Pacifica Whono and ProCare. Ezra returned to Niue in 2013 to take up a post as the radio producer for the Broadcasting Corporation of Niue and was the voice of Radio Sunshine that many enjoyed listening to. During his time with BCN, he was a valuable part of the news team and hosted talkback and sports shows. Sports was one of his passions, and he went on to represent Niue as an athlete and a coach in lawn bowls, competing at the South Pacific Games and 4 Commonwealth Games. Following a half-hour service at the Alofi Ecclesia Church, he was later laid to rest and buried at Ovava in Awasele. Ezra is survived by his wife Ezra Talamahina, 6 children and many grandchildren. That concludes our news bulletin for this evening. We do hope that you can join us again for our next news bulletin on Tuesday next week. Don't forget that there is a volleyball tournament on Saturday at Niue High School.